Hello, I am Dr. Jennifer Tanner. I am the founder of Runwell. Today we are going to be talking about the pelvic floor. You might be wondering why this is important, but we have a perfect guest on here today to help explain a little bit more about why all of us should be caring about this. I think kind of from a running perspective, one of the number one things I hear that makes me think of pelvic floor is I pee a little bit when I run. And that makes me
But that's okay. Okay.
Okay, so we have today with us a pelvic health physiotherapist. Her name is Chana. She works at Vital Physiotherapy and Wellness here in Toronto. Welcome, Chana.
Thank you so much for having me.
Tell me a little bit. So I heard a rumor about your own personal family. How many children do you have?
The rumor is out. I have 4 kids.
I love 4 kids. Big families. That's amazing. 3, and I would love to have 4, maybe even more.
Let's do it. There's totally unrelated, but there's a 4.5-year age gap between my 3rd and my 4th. Just saying.
Okay. Yeah. Okay. Yeah, that's kind of, well, mine would be a little bit bigger now. My youngest is 7. So.
But that's what got me into pelvic health.
Okay, so that was
because I had 4 kids.
Question. Yeah, is that what kind of drove you into this passion, like going through the experiences of pelvic health, and kind of like, you must have been looking for help at that time.
Yeah, I actually I tell everybody the reason why I do this is because I needed pelvic health physio. Between my 2nd and my 3rd, I was having a lot of pelvic pain, and I went to my GP, and my GP did some tests, sent me, and assessed me and said, "Well, everything is fine." And I was like, "Everything is not fine." Mm-hmm. And one of my dear friends was getting her certification in pelvic health physio, mm-hmm. and she said, "You know what? Just like, why don't you come and I'm going to assess you." Yeah. And I was like, "But you do what?" Because pelvic health physios, for those who don't know, I call ourselves the gynecologists of physiotherapists. So we're regular physiotherapists. We're trained orthopedically, and then we go for extra training on managing gynecological conditions. So when my co-physio was like, "I'm going to assess you vaginally," I was like, "Oh, no, you are not." He was like, "Listen, I think it's going to change your life." So I went to her very timidly, and I was assessed and treated, and like genuinely changed my life. Like I was so, I felt very hopeless. Like nobody knew what was wrong with me. I was going to be in pain for the rest of my life, and what did after having a baby, what did I expect? Like I didn't expect anything more. Everybody says, "Oh, well, you had a baby, so like, of course it's going to hurt a little bit when you have sex. Of course you're going to leak a little bit when you cough or sneeze. Hashtag worth it." But really, those things they're common, but they're not normal.
Yes.
And I think we need to change the conversation around pelvic health. Number one, to make it not quite as, people are not coming as timidly into the office, and make it a little bit less taboo to talk about. Okay. And especially with our athletes, like a lot of our clients they think of themselves as athletes, and then they have babies and they're like, "But I'm still an athlete." Mm-hmm. And so they go back to all the exercise they were doing prior to their pregnancy, not realizing that their body has gone through this massive change, and they truly need to rehab in order to reach that same level of athleticism that they were at prior to pregnancy.
Good point. Yeah. And I think it's a bit of a mental game too, right? You kind of want to feel like you used to feel, so you try to dive right back in there.
Yeah.
And a lot of people end up struggling, they get hurt. It's just not so much fun.
No. And then they're like, "Well, my kids ruined my body. Like having kids ruined my body." When really there's this big dichotomy between where during pregnancy, everybody just idolizes and loves that pregnant body. Mm-hmm. And then postpartum, you're supposed to pretend like you were never pregnant. Your body should look like you were never pregnant.
Yes.
These babies, it was like, you know, it was like this immaculate conception. These babies like never happened. And we need to go back during pregnancy. You're supposed to do nothing. And then postpartum, you go back to everything you were doing.
Yeah.
Where there really needs to be like some time to rehabilitate and recover. And we need to sort of move away from being these like perfect, high level athletes immediate, like having a baby, whether it's by cesarean section or vaginally, is an athletic endeavor. And in the same way that you would recover after, you wouldn't run a marathon, then run a marathon the next week. You need to do that same training before delivery, by whatever means you deliver, and then also rehab postpartum, because you wouldn't go running on a sprained ankle.
Yeah, well,
right? Because then
that's what I tell people, but
we're so alike.
So let's start with the basics. What the heck is the pelvic floor?
I'm so glad you asked. Okay, I did bring some visual aids with me today.
Love it.
So if you would put your hands on your hips, on your hip bones, I brought you a pelvis. So our pelvis is made up of these beautiful butterfly shaped bones here. And when you put your hands on your hips, you're actually holding this part right here, that top iliac crest, okay? The pelvis is made up of these beautiful bones here. They meet at the middle at the pubic symphysis. A lot of our clients have pain at their pubic symphysis during pregnancy. Common, not normal. Those hip bones meet at the back of the sacrum. Above the sacrum is your lumbar spine, and below it is your coccyx. And if you're trying to figure out where that tailbone, that coccyx is, if you take your finger and you place it right at the top of your bum crack, that's where your coccyx is. Okay. Now, this is the base of our trunk, essentially, right? And right at the very bottom are these 3 layers of muscles called the pelvic floor muscles. So those muscles go from all the way from the front of the pelvis. They go all the way to the back to that coccyx. And side to side from one sits bone to another. And when you're trying to figure out what your sits bone is, if you put your hands under your bum cheek and you sit on your bone, you'll feel a bony prominence there. That's your sits bones. Got it. You're supposed to sit on your sits bones. That's why they're called sits bones. Most of us don't. We sledge. But in theory, that's where we're supposed to be sitting.
Got it.
So our pelvic floor muscles are 3 layers of muscles that sit underneath that skeletal structure of the pelvis. Okay. And within those muscles are 3 orifices. In people who are born with uteruses, we've got urethra, vagina, and anus. Okay. And so if you look at the bottom of those muscles, you've got your urethra where your pee comes out of, vagina, and your anus. And so what is sort of like mind-blowing for most people is your vagina is actually muscular, right? And we know that because people say during pregnancy, do your Kegels, but they don't think about their vagina per se as a muscular structure. Does that make sense? So these 3 layers of muscles actually have 5 pretty big jobs. Job number 1 is to hold up all of your internal organs. And this is where my pelvis gets fun. So your bladder sits on top of your urethra and sits inside my pelvis, like that. Whoop, drop in my pelvis. All right. On top of your vagina is your cervix and your uterus. And they sit on top of bladder, uterus. So the vagina holds up also the cervix and the uterus, which is really important during pregnancy. And on top of the anus, the anus sits the rectum, and the rectum sits behind the uterus. And the rectum is connected to the intestines, the gallbladder, the spleen, the kidneys, all of your pelvic structures and all your intra-abdominal structures are held up by these 3 little layers of muscles. Okay. Now they're also held up from above by ligaments and fascia, but if these muscles are not doing their job, what we start to see is a a descent of these intrapelvic structures. Okay.
Okay.
So the front wall of the vagina is actually the back wall of the bladder.
Mm-hmm.
The back wall of the vagina is the front wall of the rectum.
Mm-hmm.
If these muscles are not doing their job, or if we put too much stress on them after something like, I don't know, a vaginal delivery before they've recovered and they're not able to hold everything up, what we start to see is a descent of the bladder backwards into the vagina, or the uterus and cervix down into the vagina, or the rectum forwards down into the vagina. And that's called pelvic organ prolapse. And while we don't have research that's A plus B equals C, you run immediately postpartum without rehabbing your pelvic floor, you're going to get prolapse. What we do know is we see a correlation between running postpartum before rehab and prolapse. So we can't say there's causation, but we know that there's a correlation between massive amounts of abdominal pressure when that pressure system isn't there to support those structures.
Okay. And when you say prolapse, you mean that some of those organ systems are starting to protrude externally
from the vagina, right? Or internally. So there's different levels of prolapse. You can get symptoms from it though, even if they're not, if your bladder and your rectum are supposed to sit like this, as soon as they start to descend down into the vaginal cavity, even if they're not outside the vagina, that can still cause symptoms of heaviness, challenges for people who use tampons or different internal devices, internal vaginal devices, or like the ring, for example, the birth control ring. Things start to fall out. Things don't feel like they are where they used to be.
Yeah. And then what about digestion? Like how much of a role does constipation play with the pelvic floor?
So the second job of the pelvic floor is actually sphincteric. So there's sphincter muscles around the urethra and the anus. So it's the job of those muscles to release both urine, feces, and gas when you want to, when you're sitting on the toilet, and also to hold it in when you don't want to go. So it's very common for us to talk about leaking urine, and I want to be really clear, even if you have a full bladder and somebody told you a really funny joke and somebody pushed you from behind while you're jumping on a trampoline, it's still not normal and totally treatable to leak urine when you're not on the toilet. You should not be leaking urine unless you're sitting ready to leak urine.
So although super common among moms, like I hear all the time, like I was at Sky Zone and people are like, oh, I can't do that.
Can't do that anymore.
I can't do that. I can't do jumping jacks at the gym when I'm doing like CrossFit or whatever. Although incredibly common, it is still a symptom that your body is telling you that something is wrong, correct?
Yeah, that's a sign that you need some rehabilitation.
Okay.
Yeah.
Okay.
And the opposite is also true. So if we see a lot of clients who have urinary retention, who feel like they go to the bathroom and haven't fully voided. And same thing with constipation. In fact, constipation can both be caused by an inability to relax the external anal sphincter and those muscles, and also constipation can contribute to urinary leakage.
Yes, I have a lot of patients that are in their 50s, 60s-ish, and they've had a history of years and years and years of constipation where they're basically straining and putting a lot of downward pressure every day for 30 years, and now they have prolapses.
And we see the same things with smokers with persistent cough, right? So it's common to even like after we see some women after delivery, if they've had a very long delivery or even a really short, quick delivery. We see it with people who have Crohn's, IBS, those kind of digestive disorders, who spend a lot of time either on the toilet with diarrhea or on the toilet with constipation.
Okay.
But it's this management of your pressures.
Okay.
Right. Yeah. And we spend a lot of time talking about toileting techniques with our clients because there's really an amazing way to optimize the musculature and learn how to release properly.
Okay. Very important.
My favorite topics.
All right. So did we cover all the jobs? I think
so we've talked about supportive. We talked about sphincteric. There's a sexual function to these muscles.
Okay.
If you're having pain with penetration, these muscles are likely overworking.
Okay.
They're too tight. They're on all the time. If there's lack of sensation or inability to orgasm, we often have muscles that are they're not strong enough.
Okay.
These muscles serve a sump pump job where they help pump the blood back up to our hearts. They're part of our cardiovascular system. Thank you for the words. And my favorite job of the pelvic floor muscles is actually part of our core. So the fitness industry uses the term core to talk about the abdominal muscles.
Yes.
But our core is actually made up of our innermost abdominal muscles, our transversus abdominis, our breathing diaphragm, our pelvic floor muscles, and our innermost back muscles.
Okay.
Those 4 muscles work in synchrony to support our spine, and also they work as our pressure system.
Okay.
So if you visualize your diaphragm, it's sort of this upside down U-shaped muscle that sits at the base of your ribs, like right at the bottom of your ribs. And when you take a breath in, your lungs expand with air. So what happens is your diaphragm should contract down, create a negative pressure in your lungs, and the lungs draw in oxygen. When you exhale, the diaphragm springs back up as the lungs contract, and you exhale your CO2.
Okay.
Right? So inhale, exhale. But we just also finished saying that inside the pelvis and inside the abdomen are all of these organs, right?
Yes.
So in theory, when you inhale, your diaphragm pushes down and it kind of constricts and compresses all of these organs.
Yes.
But what should happen in an ideal situation is that the pelvic floor should reciprocate and relax on the inhale. So the diaphragm should contract, pelvic floor actually relaxes. And as you exhale, the diaphragm relaxes, the pelvic floor contracts, and your inner abs and inner back muscles contract. So there's this inhale, exhale, inhale, exhale. Now, this whole system is upset. It's affected by pregnancy.
Okay.
So the diaphragm, I don't know with your pregnancies, at what point you are having trouble breathing, but in order to accommodate this growing uterus, your diaphragm actually shifts up and out of the way along with your other organs. Your pelvic floor takes on, let's be generous, 20 to 65 extra pounds, depending on, the pregnancy, right? Yeah. We're talking about multiples. It could be significant. Yeah. And your abdominal wall stretches in all directions.
Yes.
Right? And so it's really hard. And not to mention your posture changes in order to not fall forward with this growing weight inside of you, right? So your center of balance changes. So we start to shift where our ribs are relative to our pelvis. So this beautiful stacked relationship of this core is lost. Okay. And then postpartum, if we haven't rehabilitated that, your pelvic floor has just been, if you've delivered vaginally, has been somewhat, we'll call it, it's traumatic for these muscles. They're built to do this, but they have to be rehabilitated afterwards. Yeah. If you've had a cesarean section, you've cut through your abdominals and the innermost abdominal, so you've cut into that system that way. Your muscles have been stretched. You've spent 9 months in these altered mechanics, and nobody says to you, hey, now you need to realign. Instead, you spend all day holding a baby and feeding a baby, with hunched over. And then when you stand, you're often standing sort of leaning back to try to hold your baby up because you've got no core. Yes. And then all of our moms now, I'm going to demonstrate for a second here. Okay. Right. They tuck under because when their belly was growing, they were tucking under to not be able to, to not fall over. Yeah. And now they're holding a baby here and they're holding a baby here. And then they go to run like this. Oh my gosh. Well, no wonder they're leaking, or they're feeling like they have prolapse, or they're having pain. When they're tucked under as well, that's a position where these muscles are actually in a tightened, contracted position. Okay. So most people are like, I'm leaking. I need to do Kegels. Okay. What we find most commonly is that most of the people who we see have muscles that are really on all day, every day. It's
So,
not the contracting, it's the releasing piece that they've lost.
so would Kegels be helpful in that situation or not? They're causing overcontraction.
So, okay, so let's do a demonstration here.
Okay.
I'm gonna make you think through this. You ready?
All right.
Okay, I'm gonna do a bicep curl. You ready?
Got it. Let's see it.
Good.
Woo.
All right.
Pipes.
Stop it. Okay, here we go. Gonna do another bicep curl. If I haven't relaxed my muscles, telling me to do more bicep curls is not going to help this if my arms and my shoulders are hurting, right?
Correct. Yeah.
So what we find a lot postpartum is that these muscles just are on. So if you've you've carried a baby, so they've been trying to hold up this baby for 9 months, and then if you've delivered vaginally, they've pushed a baby through them. If your back hurts, you have an Epsom salt bath, you get a massage, you put some Tiger Balm on it, you put some heat on it, and then the muscles relax and your back stops hurting.
Yeah. What
are people doing after having a baby and carrying a baby around to manage the muscles that were holding that baby in for 9 months?
Yeah.
Right? But we're not going through any process to rehabilitate them and, quite frankly, retrain them, because the body you have prenatally is not the body you have during pregnancy, is not the body you have postpartum. You need to learn how to function in that body before going and exercising in that body. Got it.
Sounds like a plan. Sounds like something we all need.
So there's actually, I know we want to talk about returning to running postpartum.
Yeah.
And there are actually some new guidelines that just came out in 2019 for returning to running. Obviously, at this point, I think every person who's been pregnant needs to rehabilitate their body.
Yeah.
I think regardless of symptoms, quite honestly, because we see a lot of clients who are in menopause and their symptoms only start at that point when their hormones start to fluctuate again. They start to have symptoms then, and they're like, if only I had known about this 20 years ago, I would, we wouldn't be in this situation now. So, I think proactive health is to be proactive about your health is the most important thing to do. But what we know is that the pelvic floor, although it does contain a lot of shame, and they're muscles like any other, even though they're not muscles like any other. You still need to learn how to be able to contract and relax them. You still need to have endurance. They need to be coordinated with the rest of that core system, and all of those things need to be trained. Okay. And when you think about returning to higher impact running, every time, no muscle works alone. So we don't just Kegel anymore. We always train Kegel with breath.
Okay.
Because the diaphragm and the pelvic floor work together.
Okay.
And we also, we know that, like, the glutes, for example, are synergist with the pelvic floor. The lats, so pulling, hip, leg extension, that kind of, those movements, they help the pelvic floor work better. So after we sort of spend some time doing some breathing, because we do a lot of breathing around here, doing some breath work, learning how to release the pelvic floor through range of motion and then activate it properly again, we then need it to be able to work for a long time. You want to go for a half-hour run, well, being able to Kegel 10 times is not exactly that's not going to be sufficient, right?
Okay. Yeah.
And you need to know how to not only, contract and hold and then release, but every time your leg moves, your pelvic floor turns on.
Okay.
So every time your leg moves and you're running at a fast clip, you need to be able to turn on, turn off. Like, we have to be able to contract and relax really quickly, which is another level of training.
Yeah.
But before that, we also need to take into account the normal tissue healing times. Okay. So, that 6-week all clear from your care provider. So, a lot of them are like, okay, at 6 weeks, now I can go back and run. Great. Yep. But we know that it takes between 6 to 12 weeks for normal tissue healing time.
Okay. A
right?
little bit longer.
Like a minimum, right?
Yeah.
And that's just for like, even if you think about a cesarean section, for this side of the tissue to connect with this side of the tissue at that 4-month healing point, right? That's when that tissue's healed.
Mm-hmm.
So meaning it's connected.
Okay.
Not that now you can use that tissue as part of your, now we have to relearn how to use that tissue and train those muscles again.
Okay.
So our best practices is not even returning to running between 4 to 6 months, until 4 to 6 months postpartum, pending that you've trained everything else at that point, because that's when our tissue just starts to normalize.
Did you hear that, ladies? 4 to 6 months.
To start training.
Yeah.
Because that sets you up for success. I mean, if we go back to that running on sprained ankle analogy,
yeah,
right, you really want to give that ankle enough time to heal so that you're running for life.
Mm-hmm.
Right? It's a decision between, am I going to run right now versus am I going to be running for the rest of my life?
Yes. Great decision.
Right.
Great thought process through that one. Now, if somebody is like, I'm fine, and they pick up and start running, are they at more risk for diastasis recti?
Okay, so what is diastasis recti? So
Tell us.
Okay. So diastasis recti, we talked a little bit about how the abdominal wall in general stretches during pregnancy. And if you would have asked me 5 to 10 years ago, our conversation would have been a little bit different, because we've gone through this whole process of like nobody talking about it to all of us talking about it and being like, never do anything if you have diastasis, to now like, okay, here's what we're actually going to do with diastasis. So diastasis recti, we have 6-pack muscles. All of us have 6-pack muscles, right, Jen? Yeah. Mm-hmm. Great.
Yeah. Oh, yeah.
Which is they're there. It's essentially like a 3-pack and a 3-pack, and they are connected by this thick fascial connection called the linea alba between them. Mm-hmm. And then they're also connected, each of those squares of muscle, the 3-packs, are connected laterally as well by thick fascia.
Yes.
And we know during pregnancy, this whole area stretches. Mm-hmm. And we know now that between some of our studies say 60%, some studies say 100% of women in their 3rd trimester have diastasis recti, meaning that tissue, that linea alba between that 6-pack has stretched out. Mm-hmm. So there's a thinning of that tissue.
Yeah.
Now, at that 6 weeks postpartum, we used to say, well, if your tissue is still, if you do a sit-up, you do a little sit-up and you see a bulge or a divot in between those 6-packs, then you have diastasis recti.
Okay.
So we're actually moving away from talking about diastasis as a separation of the muscles. Okay. And the reason is because there's no normative values, and we don't really know what the distance was for most women between those rectus muscles. Okay. So we used to say 2 fingers separate. Used to talk about it as a separation of number of fingers between those 6-packs. Yeah. Right? Those 3-packs. But we don't have normative values. We don't, like, some people might naturally have a separation like between those muscles, and there was just really thick connective tissue, so you couldn't put your fingers down. Yeah. What we know now is it's really not normal to be able to fit your fingers down between those muscles. Okay. So we talk about it in terms of, are you able to get those muscles functioning? So can you get that inner abdominal muscle? How strong is it? If that is strong, by virtue of the way that the anatomy works, if we can get that innermost abdominal muscle stronger, you are not able to set your fingers down between those 2 6-pack muscles. Okay. 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 Now, let's go a step back again and recall that we talked about this inner core as being the diaphragm, the pelvic floor, inner abs, and inner back muscles. And in theory, the diaphragm sets that tone. So when you inhale, the diaphragm descends, the pelvic floor should release on that inhale. Okay. And on the exhale, the diaphragm springs back up, the pelvic floor engages, and should cue that inner abs and inner back muscle to turn on. Okay. By virtue of the fact that during pregnancy, everything kind of shifts out of position, we have to retrain that whole system. And so for some women, that means just teaching them how to align, how to breathe in that position, how to cue their pelvic floor so that it naturally cues that inner abs. But I think that we've really gotten stuck at that point. So what you'll see a lot now is people saying, well, to rehabilitate your diastasis, you just have to breathe and Kegel.
Okay.
But that's our starting point. We know, like in Major League pitchers, or just in pitchers, we have research that suggests before they even lift their arm up, this inner core system turns on.
Absolutely.
So this is our preemptive core, right? This core system sets the stage for the rest of the muscles to work. So we create stability here with this system, and then everything else can create mobility around it.
Yeah.
So I think this step that we've sort of lost, or maybe sort of scared women away from doing, is actually strengthening their body after doing this core, what we call core breath, that inhale, exhale, and activate. Then we move. So the question is, does postpartum running cause diastasis? No, but if you're leaking postpartum or you do have diastasis, that's an issue with your pressure system. And then by adding impact onto it, you're going to start to see leaks in this pressure system, either urine or diastasis worsening, or back pain or hip pain or knee pain. If your body isn't set up to be able to take on that load, you're going to feel it eventually somewhere.
Yeah, and there's for those of you who have been listening to all of the summits, Dr. Emily Spleichel, she's out of New York City. She talks about the same thing in regards to, she uses that exact same pitcher analogy, and that it's not your arm that moves first. So we really need to inhale, exhale, activate. That is, in her opinion, that was one of the best ways to be preventing injuries.
Yes, I love it. So, and learning this, it's a system that was unconscious prior to pregnancy. And so the challenge is starting to learn how to use a system you never had to think about before, but has also been altered.
So let's put this into running now. So before I actually go, say I've done my 4 to 6 weeks working with a pelvic floor physiotherapist, I'm ready to go. So I got my shoes on, I'm about to head out the door. Would I actually inhale, exhale, then start running? And would I continue to consciously inhale, exhale, like with my pelvic footsteps?
So what we would do is we would actually we would train you with a whole bunch of running exercises beforehand. So you would be trained in single leg squats. You'd be trained in step ups. You'd be trained in lunges. You would be trained, we would go through all of those pieces. And we would even have you just walking, inhale, exhale, Kegel, inhale, exhale, Kegel. And then, but the reality is when you're actually running, your muscles have to go so quickly that it's not quite as helpful. I almost think it gets people too much in their heads. I would just suggest focusing on diaphragmatic breathing. And it's usually not the beginning of a run where we see people leaking. It's usually towards the end when they're fatigued, and then they start to compensate, and then we start to see altered breathing patterns and altered gait patterns, where that's where we start to see the leaking. So it comes back to running mechanics at the end of the day.
And with those running mechanics, is there an ideal posture that we should be trying to maintain while we're running?
So my answer to that is always no, but yes. So I don't believe that there's an ideal posture for you. And that's usually it's more of a forward lean. It's a forward lean because that starts to align our ribs over our pelvis a little bit more. Right? Yeah. It's a lot of the same running techniques that we teach runners when they're to getting their glutes activated. What we generally try to find is somebody's easy breath. So if they're working really hard to get their breath in, they're not in a position that optimizes this core system, right? So we want people to be breathing diaphragmatically as much as possible. So sometimes that means altering their pelvic position. So coming more into an anterior pelvic tilt. I call it little tail lift. Imagine you have a tail, lifting that tail up. We want to move away from like that upper chest run. We see a lot of runners, especially postpartum women
Yeah.
running with their headlights pointed up and not forward.
Got it.
So your headlights should guide you. Right? And which is no different than actual best practices for running.
Yeah.
Right? But when you're on a weakened system, we compensate in many ways, and the compensations tend to trend in the same way.
Okay. Got it.
Did I answer your question? I feel like no. Okay.
Well, yeah, it's individual, right? Now, can men suffer from poor pelvic health strength as well?
Yeah,
Okay.
definitely.
So
Definitely. So
not just a ladies.
No, in and around pregnancy is a really common time to see it, but it's not the only. It's not certainly not. We see. I would say in our caseload, 60% are prenatal and postpartum.
Yeah.
20% are women in and around menopause, and then 20% are males, young athletes, and non-binary people.
Okay. And what would a young athlete be coming in for? What would their main dysfunction be? Leaking. Yeah.
Leaking, hip pain.
And related to overuse?
Yeah.
Okay.
Runners in general trend to go hard or go home.
Yeah.
And in life, we all need balance. And so runners need that too.
All right. Everybody, we need some balance in here. So to recap a couple of things that Chana has touched on, that we need that pelvic floor to hold all of your organs basically in place. That's one of its number one functions. And that if you're experiencing those symptoms, like she said, that there's some pain, some discomfort, if you are peeing when you run or you go to the trampoline, that is a big, like, you should have that light bulb coming on going, I'm thinking about this. This is common, but this is not normal. So you need to seek out a pelvic floor physiotherapist like Chana herself. And the healing times from postpartum are actually much longer than what we may have thought. So the 6-week rule doesn't no longer apply. You're looking at more, what did you say, up to 4 months?
4 to 6 months before we even start. And I would say, hormonally, probably 18 months. We're still in that postpartum period.
There's still fluctuations, there's still changes. And nursing would
definitely add to that.
Would add to those issues as well. Now, Chana has so generously, she has put together a postpartum core rehab for all of us. So at the end of this, you will be linked over to have access to that. Can you just give us a quick synopsis on what the postpartum core rehab is?
So it's it's our top tips for rehabbing your core postpartum. And generally speaking, people think about sit-ups, and it's a lot more, it's very different than what most people think.
Okay.
And so it's a lot gentler.
Okay. Yeah. If anyone, I would imagine, if anyone has been to see like a Pilates therapist one-on-one, and how first time I went to see one, she was making me move. She goes, no, move smaller movements.
Yes.
Okay. So
smaller
and smaller. And I was thinking, what is this going to do? I'm barely moving. And I went home and I thought, okay, that was okay. And the next day I woke up and I could feel everything. And it was amazing.
Yeah.
So I imagine that the traditional sit-up is not the ideal rehab.
Right. And listen, I we used to say never do sit-ups again. I don't say that anymore. You want to do sit-ups, let's get you doing sit-ups. Like, great. But we need to think about function before we think about anything else.
Yeah, absolutely. So if somebody wants to get a hold of you because they're questioning the quality of their pelvic floor strength, how might they do that?
So you can find us over at Facebook at Vital Physiotherapy and Wellness Toronto.
Okay.
We're on Instagram, Vital Physiotherapy and Wellness, and the and is all spelled out A-N-D. Or you can head over to our website, vitalphysiotherapy.com.
I love it. So thank you so much for coming on today and giving
a
little bit of enlightenment onto this topic. I don't think it's something that everybody has and top of mind. And I think it's a very important topic, especially for this impact running community. And like you said, we want these people to be running like especially those moms, we want them to
Life.
show their kids and like do this as a family event. So much appreciated for the information, and thank you again for including that postpartum core rehab.
Thank you. I really appreciate you having me.
Okay, bye.